Today I'm here with Lina, Eliason and Christina Jackson, the authors of a how-to guide to working in the private sector and the newly published Palgrave Handbook of Consultancy and Health Psychology. This book was edited by Rosanna Brady, Judith Varkonyi-Shep and Jan Smith. It gives practical advice to the new generation of health psychologists who want to work with or within the pharmaceutical industry. So for the chapter, how did the opportunity come along, first of all?
The opportunity came along because we knew one of the editors. It felt like a great opportunity because me and Christina have worked with pharmaceutical clients for a very long time. Originally as experts when we were in academia and we were engaging directly with pharma companies. After academia, both me and Christina started working for more of a boutique company that really focused on using health psychology to support patients in managing their treatments and their health. And that was very much focused on patient and caregiver support programs. And then after that, we have experience working for large CROs, clinical research organizations. I used to work for one of the biggest ones in the world. And then obviously founding Sprout. And by the time we founded Sprout, all of that experience that me and Christina have gathered really helped us to set up, with a vision of what we wanted to do that would really inspire employees to come and join us. Knowing all of that, the editors reached out and said, would you like to contribute to this book? And me and Christina jumped on that and thought it'd be great. We have learned so much over 15 years, 20 years working in the space. What else is out there? And as we started digging in, actually, it turns out it's not really anything out there that is supporting health psychologists and other psychologists getting into the consulting world.
We really wanted to make it like a step-by-step approach to working with pharma, because I think we had to learn all of this the hard way. It would have been so helpful when we started if there was a chapter like this and you could read it as you start your new job and it would give you some insight into what it is that you're going into and how to go about it.
If there was one big takeaway, what would you say it is?
Something which is different working in the private sector compared to working in, for example, academia, is the pace. If you are someone who likes to bring a great idea to fruition, that enjoy a fairly fast-paced environment, if you like to solve problems, it's a great place to work.
The takeaway is that there is a huge opportunity for psychologists to work with pharmaceutical companies. It's a growing field. It's grown a lot since Lina and I started, but there is so much more opportunity out there. People don't know that these jobs exist. I would really like people to come away thinking, actually, with my background in health psychology, with my PhD, my doctorate, I can really apply that in a real world setting, in a commercial, fast-paced environment and make a difference.
So the chapter outlines a range of opportunities for growth for health psychologists in areas such as the clinical outcomes assessments or behaviour change. Where do you see health psychologists offering the most value to pharmaceutical companies today?
Psychologists have a huge role to play anywhere that the patient's behaviour has an impact on outcomes. It is fundamentally important to pharmaceutical companies that the drugs that they develop are developed in such a way that patients are going to take them and that there's support for patients in order to be able to take them. When you think of that huge, the years of development it takes before a drug comes to market, if it comes to launch and it's something that no patient sees the need for, they don't want to take it, it's not palatable in any way, the regimen is really difficult, it's going to be really difficult for that drug to succeed. Psychologists can help pharmaceutical companies right through that drug development process to understand what is it that is most important to patients. So that's considered right from the very beginning, right from that molecule selection stage all the way through to launch and beyond launch, providing support.
One of the most practical parts of this chapter is finding your first pharmaceutical client. So what piece of advice would you say to someone who's new to the industry?
Identify a conference or industry meeting where pharma companies are likely to have representative. ideally those that are related to some research that you have conducted. While you are a student, looking for opportunities to have work placements or internships, either with consulting businesses like Sprout, which are working with pharma companies, or indeed within a pharma company, can really help you to create an early network and contacts that hopefully once you graduated and you want to start working with a pharma company, they will give you a foot in the door.
Could you explain to me, like I'm 5, some common health-related behaviours that behavioural psychologists look at when we talk about behaviour change?
Some people have health conditions that affect them every day. They're things that you have to manage through your whole life. There are things that people need to do so that they can manage their health. They need to have a good relationship with their doctors. They need to understand why they've been given medicines and make decisions about taking those medicines. And there might be lots of other things to do with their illness that they need to manage. How do you carry on working? How do you manage some of the feelings that you might have around your illness? In health psychology, there's been a lot of research in supporting all of those types of behaviours.
So aside from industry knowledge, what's something that makes a consultant stand out as exceptional to a client?
So from a business perspective, having the right people to support you, from functions like a good lawyer to review your contracts and help advise on that, to an accountant that ensure that you do all of your books correctly and follow tax laws, to great project managers that keep projects on track and to budget, to, of course, a wider team as you grow and your services become bigger. All of those things are incredibly important. You are extremely unlikely to be able to do everything yourself. Deliverables need to be on point. If you are working independently, get a reviewer or an editor, go over the content so that it doesn't come back to the client with typos or silly mistakes. The professionalism will really communicate your expertise. I think something else is people don't necessarily expect an answer up front. Don't be afraid of saying that you need to look into it. That is something that requires research. It's okay to say, let me get back to you. Never agree to a big decision on the spot. If someone asks you for a discount, if someone asks you to do something extra that wasn't within the scope you had planned, tell them that you will consider it and you will get back to them.
Do you have a story you can share that's either from a very successful partnership or from a lesson that you've learned that would be helpful for someone who's starting out in the industry to hear about?
If a potential partner is extremely difficult to contract with, it's a red flag for what a future relationship might be like.
Your role in a team is going to be as an expert, and that's because you have skills that are valuable and knowledge that is valuable. And so you should have confidence in your opinion and letting the client know what your opinion is.